Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study from the Journal of Veterinary Internal Medicine that explores a simple yet potentially powerful tool for predicting outcomes in sick, newborn foals. As many equine practitioners know, the initial days of a foal's life can be precarious, and identifying those at highest risk early on is crucial for providing the best possible care and communicating effectively with owners. Currently, assessing the likelihood of survival in these vulnerable patients often involves complex scoring systems, multiple clinical and laboratory variables, and sometimes advanced, specialized tests. Furthermore, accurately pinpointing the primary problem or the specific infectious agent can be a time-consuming and challenging process. What if there was a readily available, objective measure derived from a routine blood test that could give us valuable insight into a foal's prognosis right at the time of hospital admission? This is the question that researchers Amanda Samuels and colleagues set out to investigate. Their focus is on a biomarker known as the neutrophil-lymphocyte ratio, often abbreviated as NLR. In human medicine, the NLR has emerged as a useful indicator of a patient's outlook across a wide range of illnesses, including infections, inflammatory conditions, and even cancer. The beauty of the NLR lies in its simplicity. It's calculated by simply dividing the absolute count of neutrophils, a type of white blood cell involved in the early immune response, by the absolute count of lymphocytes, another type of white blood cell critical for adaptive immunity. This information is readily available from a standard complete blood count, a test commonly performed on sick foals. The NLR essentially captures the dynamic interplay between these two key components of the immune system in response to stress and imbalances in the body's inflammatory and immune processes. While the NLR isn't a completely new idea in equine neonatology, its widespread clinical application has been limited, often based on individual experiences or smaller studies focusing on specific groups of foals, such as premature or non-infected ones. These earlier reports hinted that foals with sepsis, a severe systemic infection, might have a lower NLR compared to healthy foals, and that a low NLR could suggest a poorer prognosis. However, a large-scale study involving a diverse population of sick hospitalized neonatal foals was needed to determine if the NLR, independent of other factors, could provide reliable prognostic information. Therefore, the researchers embarked on a retrospective, multi-center study involving a significant number of client-owned foals, less than 4 days old, admitted to 3 different equine referral hospitals. Their main objectives were to establish the NLR at admission in foals classified as either sick non-septic, meaning they were ill but their sepsis scores were below a certain threshold, or septic, indicating a higher likelihood of severe infection. They also aimed to compare these NLR values to those of healthy foals and, crucially, to determine if the NLR at admission differed between foals that survived and those that did not. Ultimately, they wanted to evaluate if the NLR could serve as an independent predictor of non-survival in these young patients. Their hypothesis was that sick hospitalized foals would generally have a lower NLR than healthy foals, and that a lower NLR would be indicative of more severe illness and associated with a higher risk of death. Now, let's turn our attention to the findings of this extensive study. The researchers analyzed data from 1196 foals, including 993 sick foals that required hospitalization and 203 healthy foals. Among the sick foals, 307 were classified as septic and 686 as sick non-septic based on their sepsis scores. Interestingly, the study revealed that the median NLR was significantly lower in the sick hospitalized foals compared to their healthy counterparts. Furthermore, the septic foals had the lowest median NLR of all the groups. This initially seems counterintuitive, as in adult animals and humans, a high NLR is often associated with severe inflammation and poor outcomes. When the researchers compared the NLR between foals that survived their hospitalization and those that did not, they found a significant difference. Non-surviving foals had a considerably lower median NLR at admission compared to the foals that were discharged alive. This pattern held true when looking specifically at the septic foals. The septic foals that did not survive had the lowest NLR of all. However, in the sick non-septic group, the difference in NLR between survivors and non-survivors was not statistically significant. To further explore the prognostic potential of the NLR, the researchers used a statistical tool called a receiver operating characteristic curve, which helps determine how well a test can distinguish between two groups. They found that an NLR below certain cutoff points at admission was associated with a significantly increased odds ratio for non-survival in sick hospitalized foals. Specifically, a NLR of less than 3.06 and a NLR of less than 1.6 were both strong indicators of a higher risk of death. The study also looked at the relationship between the NLR and other factors known to influence foal health. They found that there was a negative correlation between the sepsis score and the NLR, meaning that foals with higher sepsis scores tended to have lower NLR values, while low levels of immunoglobulin G, an important antibody passed from the mare to the foal in colostrum, are known to be associated with poor outcomes. The study found no significant correlation between IgG concentrations and the NLR in the overall group of sick foals or within the septic or sick non-septic subgroups. However, they did observe a weak positive correlation between IgG concentrations and a low NLR. Similarly, despite the fact that stress hormones like cortisol can affect neutrophil and lymphocyte counts, the study found no correlation between cortisol concentrations measured at admission and the NLR in either the sick non-septic or septic foals. Finally, the researchers examined whether prematurity, defined as a gestational age of less than 320 days, influenced the NLR. Interestingly, they found no statistically significant difference in the NLR at admission between premature and full-term foals. These findings led the researchers to a comprehensive discussion of their implications. Their observation that sick hospitalized foals, particularly those with sepsis, have a lower NLR compared to healthy foals aligns with some earlier, smaller studies. More importantly, their finding that non-surviving foals have a lower NLR, independent of their sepsis score or prematurity status, strongly suggests that the NLR at admission can provide valuable prognostic information. This adds to the growing body of evidence in veterinary medicine that the NLR can be a useful biomarker. The study highlights a key difference in the behavior of the NLR in sick foals compared to humans and other adult animal species, where a high NLR is typically associated with severe illness. In foals, the lower NLR in severely ill and non-surviving animals appears to be primarily driven by lower neutrophil counts, rather than an increase in neutrophils coupled with a decrease in lymphocytes, as often seen in other species. This suggests that in these young foals, an inability to mount an adequate early immune response, reflected in lower neutrophil numbers, might be a critical factor in disease progression and outcome. The fact that neutrophil counts alone showed similar sensitivity and specificity to the NLR in predicting non-survival further supports this idea. The researchers proposed that the NLR could be a reflection of critical immune inflammatory imbalances in sick foals and could serve as a valuable tool for clinicians in the early stages of hospitalization. While the study did not aim to identify the specific underlying cause of illness, the NLR appears to be a marker of overall disease severity. They acknowledge that in human medicine, the NLR has been debated for its lack of specificity, as it can be influenced by various factors. However, in the context of sick neonatal foals, this study provides strong evidence for its utility as a prognostic indicator. The lack of a strong correlation between NLR and IgG levels suggests that these two measures might reflect different aspects of the foal's immune status. While IgG levels are crucial for long-term immune competence, the NLR might be capturing more immediate changes in the cellular immune response. Similarly, the absence of a correlation with cortisol levels, despite the known role of stress in immune modulation, could indicate that the relationship is complex and might involve other stress hormones or changes occurring earlier in the disease process. The finding that prematurity did not significantly impact the NLR at admission was also notable, potentially suggesting that other disease processes have a more dominant effect on this ratio in sick foals. The researchers point out that the wide range of NLR values observed in healthy foals is different from the narrower ranges seen in healthy adult humans and dogs. This could reflect the dynamic changes occurring in the immune system during the early neonatal period or even breed-specific differences. This wide range in healthy foals made it challenging to determine if a high NLR in sick foals was also associated with a poor prognosis, as there were fewer sick foals with markedly elevated NLR values. Despite the valuable insights gained, the researchers acknowledged several limitations of their retrospective study design. The study relied on existing clinical records, which may have lacked information on certain factors that could influence the NLR, such as foaling complications, prior treatments administered, or gestational issues. For example, prior use of antimicrobials, anti-inflammatory drugs, or plasma transfusions could have affected the white blood cell counts at admission. As with any retrospective study, the researchers could not establish a direct cause and effect relationship between the NLR and non-survival, nor could they assess the temporal changes in NLR over time. Furthermore, the study excluded foals euthanized for financial reasons, which may have slightly skewed the representation of the most critically ill foals, although the researchers believe this exclusion helped to more accurately capture the correlation between NLR and medical non-survival. In conclusion, this study provides compelling evidence that the neutrophil-lymphocyte ratio at admission is associated with non-survival in hospitalized foals 4 days of age or younger. The researchers suggest that calculating the NLR, and particularly carefully evaluating the neutrophil count, upon a foal's arrival at the hospital could offer clinicians valuable clinical and prognostic information to aid in medical decision-making and enhance communication with owners. Given that a NLR below 3.06 appeared to identify a broader group of at-risk foals, including both those classified as sick non-septic and septic, The NLR could serve as a useful early screening tool to recognize foals that might benefit from more intensive diagnostic testing and aggressive supportive care from the outset of their hospitalization. The study underscores the importance of the neutrophil count as a key indicator of outcome in these young patients. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.